Who is not a candidate for liposuction? Okay, I'm only gonna do the top 5 because a lot of people that are not candidates for surgery for many reasons that are medical reasons, which we all understand, but assuming that you're healthy, otherwise no medical issues, not taking any medications. Number 1, person with already loose skin. When people come to my office, they say, I have all this fat, can you remove it for me, doc? And they pull it out of their pants and bring it forward. That ain't fat, that's loose skin. Pinch it between your fingers. If you're grabbing the skin between your fingers and you're pinching it like this, you've got 2 layers of fat between your fingers. That means that the total amount of fat that's there is maybe less than half a centimeter. What you're feeling and what you're squeezing is extra skin. So people with loose skin is number 1, because that liposuction ain't gonna fix that problem. Number 2, people with poor quality skin, crepey skin, thin skin, poor looking skin. Why? Because after you do the liposuction, they're more likely to have loose skin. They're more likely to have complications related to the thinness of that skin, and they're not going to get a tightening of that skin afterwards. They're not going to get a good result. Number 3, let's just say anybody who may be healthy but is doing unhealthy things. Smokers, drinkers, people that are taking all kinds of recreational drugs. Maybe people that are taking steroids. I'm talking about anabolic steroids. People that are on a roller coaster of other types of medications. Why? Because those interfere with healing. And although the liposuction hole is tiny on the outside, it is a huge surgery on the inside. So if you're on medications or you're taking, let's say, drugs that you shouldn't be taking, those things can decrease your ability to heal and can make the result not so great. Number 4, okay, patients that are not great candidates for liposuction are patients that do not have a lot of fat. Thin patients come into me and they say, oh my gosh, this area really bothers me, that area really bothers me. I'm like, you already look pretty good. We do liposuction, there's a lot of risk associated, risks of contour abnormalities, and if you're thin, you're more likely to see those things. So you have to be very careful and be thoughtful about who you're offering the surgery to. If there's a very discrete small area of fat that bothers you, maybe it's accessible, maybe it's reasonable, but very thin patients, not a great candidate for liposuction surgery. And last and final, the opposite, very heavy patients, large patients, patients that are overweight, and they come and say, hey, I want this liposuction surgery so that you can remove all this fat so that I can be skinny. Not a good option, because why? There's a limit to what we can do. In California, 5 liters is the limit for what we can remove without having to put you in a hospital to observe you. And if you think about it, that's actually not a lot of fat in somebody who's extremely overweight or somebody who's got a BMI above 30, 35. So I would say anybody who's overweight, who's looking for liposuction as a cure to their problem, definitely not a good option. So those are the 5 quick hits for people who are not great candidates for liposuction.